I am Col Rajeev Mannali. I am the Executive Director of Gurudeva Charitable Trust and Srinarayana Institute of Medical Sciences. I would first like to introduce myself as basically as a soldier. I have been trained and taught the art of killing actually, but now of post-retirement I am into another profession which is as noble as my earlier profession. Here I am helping those professionals who save lives. So I feel God has been extremely kind to me, having given me this opportunity to see either end of the spectrum of life. I am extremely grateful to the Almighty for that. I belong to Kerala. In fact, I belong to a place known as Chennai, which is just about 10 kilometers away from this place. Right through my career in the army as also later, my interest has always been to get back to your roots, serve the society, serve the community that has given you the opportunity to be whatever you are, and also do as much as possible to help the poor people around, see that the healthcare is available to them, and also health awareness is available to them so that they can lead lives which prevent diseases rather than getting cured whenever there is a disease that afflicts them. The landscape of Kerala, coming to it now that you have asked this question, as we all know, Kerala is known as the God's own land, and the landscape is definitely very pretty, possibly one of the best states in the country today. As far as healthcare is concerned, Kerala has always had the advantage of literacy to start with, and coupled with that, other indices of human development have been pretty high, primarily stemming from the aspect of literacy. In Kerala, the healthcare, especially the primary healthcare system, is very sound and is based on solid brickwork or solid foundation, and I think the governmental sector is actually taking care of the primary needs of the citizen. However, when the need for super speciality and extraordinary care was felt by the society, private hospitals have also entered the field not to provide the basics but to add on and give whatever the government service sector has not been able to provide. In the same breath, I would also like to say the medical colleges, the governmental medical colleges in Kerala, with also super specialty centers like Sri Chitra and Regional Cancer Center and all that, are providing excellent service to the people. But the space that the private healthcare occupies in Kerala is providing super specialty and, if I may say so, extraordinary care. That is what the private sector is providing. Now, coming down to healthcare combined with healthcare education or health education, there are about 23 private medical colleges in the state. They are also playing an important part in providing the basic infrastructure for medical education, especially as UG students for providing the primary education in the field of healthcare. In Kerala, there's a lot of craze for amongst the students to go in for medicine as a profession. This is a very important aspect. Prior to the private medical colleges stepping in Kerala, Kerala is a late entrant as far as granting permission to private medical colleges to operate are concerned. The students from Kerala used to be going to other South Indian states or even the northern states. Come 2001 or 2002, I am not too sure about the year, but it's around that period, when the state government opened up health education to private players. Since then, as I mentioned earlier, there are 23 medical colleges in the state. They are providing human service and providing space for our own students from Kerala to get education both as a UG as also as a postgraduate. This is the scenario in the landscape of healthcare and as also health education in Kerala. Like I mentioned earlier, I am heading Gurudeva Charitable Trust as also Srinarayana Institute of Medical Sciences, which is one of the units of Gurudeva Charitable Trust. Gurudeva Charitable Trust is an initiative of around 493 philanthropists who have done extremely well in their lives and are wanting to give something in return to the society, and they have entered the healthcare and healthcare education field here in this rural area, a relatively backward area, with the purpose of adhering to and following the principles of Sri Narayana Gurudevan, as he is normally known, who is a saint who lived in Kerala 100 years plus back, and who was primarily responsible for reforming the society in Kerala. As you would know, once upon a time, Swami Vivekananda had, in his despair, criticized the Malayali society as saying that Kerala is like a lunatic asylum because of the caste structure and the caste and religious prejudices that were in vogue. It is entirely to the credit of Sri Narayana Gurudevan, who has changed the landscape of Kerala. It's one of the best states today where inter-caste, inter-religious equations are all rather well set. You will not see untouchability, or you will not see the caste prejudices as it is seen in some other parts of the country today. And it is on the lines of the principle. Gurudevan is the saint who announced, and which is picked up and followed by the society on its own, to say that one religion, one caste for humanity. This was his most attractive slogan that transformed the state of Kerala. And based on his principles and his vision, the promoters of this charitable trust, Gurudeva Charitable Trust, entered the field of health education, and they decided to be here. They chose this place because this place has all the attributes of a typical rural backing or rural setup in Kerala, and they have been singularly successful in doing such a philanthropic act which has changed at least the face of this area. And today, that is after almost 11 years or 10 years to be precise, this institution stands as a landmark in the periphery of Cochin, providing excellent education as also excellent healthcare. We have every department that one would find in a good medical college in Kerala. In addition, we also have most of the super specialities. We are in the process of setting up an excellent cath lab, and also we are in the process of renovating or adding on 8 more OTs, which will cater for cardiac surgery and other super specialty surgical departments as well. We are also in the process, or we are in the workshop of starting a oncology center also here, and we are also thinking of spreading our educational avenue which we can provide by starting a nursing college and maybe a pharmacy college and things like that as we go along. The point to note is that we as an organization, the Gurudeva Charitable Trust, and the institution that the trust has created, that is Sri Narayana Institute of Medical Sciences, is a comparatively young organization which provides healthcare and health education in the state. Our USP is that we exist for the community. We are here to serve the community because, like I mentioned, our promoters were most of them are very, very successful businessmen abroad, and others are equally successful entrepreneurs in Kerala. And collectively, when they took a decision to start something on the name of Sri Narayana Gurudevan, they were all united in one aspect, that this institution should serve the interest of the common man in the rural backdrop of Kerala. So that precisely is the USP. We exist for the common people. We exist for people who can otherwise not afford healthcare or health education, and we are proud of the fact that we have been able to do this in no uncertain terms. Right now, though we have everything and we are very comfortable with what we have, we would soon be getting into the field of accreditation. We would like to see ourselves as an NABH accredited medical college. As you would know, NABH accredited medical college hospitals are rare. You will find a number of NABH accredited hospitals, but a medical college hospital, they stand out, they are different because they are catering for the patients who are from the lower economic background. So therefore, you will not find very many medical colleges which have their hospitals accredited. We would like to be pioneers in this field. When I say pioneer, we may be the second or third possibly to go in for NABH accreditation and get it. So that is one of the changes which I would like to see, which will bring in a sea change as far as our quality consciousness is concerned, and we would be able to provide the best for our patients which any other corporate hospital in the country can do. That is one change. The second change I would like to see is to start more super specialty centers like oncology, which is a very, very major issue today. Cardiology, I have already mentioned about it, and other such super specialty centers we would like, centers of excellence we would like to build up to see that people of this area benefit as much as any other rural area by having our presence here. This is what we would like to see. And as far as the education is concerned, we would like to go in for PG seats. We only have 2 non-clinical PG programs at the moment. We would like to have all PG programs being run here, and we would also like to have super specialty programs coming up like DM and MCH. That is what our dream is, and I am sure with Gurudevan's blessings we will be able to achieve it as soon as possible. The issue and challenges that we face, firstly, in Kerala, the value of private players in healthcare or education is not fully realized. That's precisely the reason why medical colleges in the private sector didn't start in the state till as late as 2001 or 2002. That being the scenario, the colleges which have started from that time frame onwards have done extremely well, providing education and also healthcare to people who were not into that segment earlier. I am very glad to say that we are in a rural area here, which is about 35 kilometers off Cochin, and this area, any rural area, has its own problems. And when you say area is backward, it is also because the people in that area have not been at the exposure which a metro or a city would have. So I feel that the manpower which we possibly have recruited in the earlier stages may not be really the best that we could have hired at that point in time. But that was a very deliberate decision because we wanted this rural area to develop, and I am proud to say that our institution is one of the institutions that has helped develop the community as we grew. And therefore, that little hitch apart, we have come to a stage when we are now finding the resources, human resources or human talents the way we want it, and we try and ensure that we recruit locally and provide opportunities for people who are otherwise deprived of such opportunities. So it is a challenge which I think we have almost overcome, or we are in the process of overcoming, and I think it is worth the time and the effort that we have been able to strengthen this area where we actually belong.